Have you ever felt a strange sensation come out of nowhere? One minute you're fine, and the next, your tongue feels like it's burning, or it feels like invisible tingles are crawling across your skin. You might think it's stress or an allergy, but what if it's something else? We all hear about the classic menopause symptoms: hot flashes, mood changes, sleepless nights. But many women report experiencing symptoms that are rarely talked about. That's because hormone receptors are located all throughout the body. So when estrogen, progesterone, and testosterone levels shift, unusual effects can show up in surprising places. Often these symptoms are dismissed, not just by family and friends, but sometimes even by healthcare providers. It's no wonder you might feel confused or even anxious, wondering, what's going on with my body? The truth? Nothing is wrong with you. Your body is navigating a major transformation, and it's expressing that in some unexpected ways. Today, we're uncovering 5 of the most unusual and misunderstood symptoms of menopause. We'll explore what they are, why they happen, and most importantly, remind you that you're not alone. Symptom #1. Burning mouth sensation. Burning mouth syndrome. Imagine enjoying a warm drink, and suddenly you feel a sharp, unexplained heat in your mouth. Or a tingling spreads across your tongue, seemingly out of nowhere. This is known as burning mouth syndrome, and it affects many women during menopause. Some experience dryness, a metallic taste, or a lingering irritation. It can impact everyday things like eating or speaking comfortably. This condition is linked to declining estrogen levels, which affect saliva production and the nerves that control sensation and taste. Less saliva means less protection, which can lead to irritation. Additionally, hormone changes may make oral nerves more sensitive. While there's no instant fix, many women find relief through hormone therapy, staying hydrated, and avoiding spicy or acidic foods. The key is recognizing it as a physical hormonal issue, not something imagined or rare. Symptom #2. Tingling or crawling skin sensation. Formication. Have you ever felt like something was lightly crawling across your skin, only to realize nothing is there? This is a form of paresthesia, specifically called formication, and it's surprisingly common in menopausal women. It may show up as tingling, numbness, or even small electric shock sensations. These feelings, while brief, can be deeply unsettling. Hormonal shifts can impact the nervous system. Estrogen helps keep nerve signals smooth and well-regulated. When levels fluctuate, nerves can misfire, sending confusing signals to the brain, resulting in odd sensations. Rest assured, these feelings are real and medically recognized. Understanding them can take away some of the fear and help you manage them more confidently. Symptom #3. Voice changes. You speak and realize your voice sounds different. Maybe it's raspier, lower, or more tired than usual. You might clear your throat constantly or lose vocal stamina during conversations. This isn't just coincidence. The voice box, or larynx, is sensitive to hormones. Estrogen keeps the vocal cords flexible and well lubricated. When estrogen drops, these tissues can become dry and less elastic, similar to how the skin changes during menopause. This shift can impact anyone, but especially women who rely on their voice for work. Staying hydrated helps, and hormone therapy may be an option for some. Most importantly, these changes are normal and nothing to be ashamed of. Symptom #4. Sudden chills, cold flashes. We've all heard about hot flashes, but what about their chilly counterpart? Cold flashes are sudden drops in body temperature that can cause shivering and goosebumps, even in a warm environment. They can occur randomly or follow a hot flash, leaving you suddenly cold and uncomfortable. This is your brain's thermostat, called the hypothalamus, getting confused due to hormonal changes. It might overcorrect after a hot flash, leading to a deep chill. Layering your clothing and keeping your environment easily adjustable can help you stay comfortable while your body adapts. Symptom #5. Bowel control issues, bowel incontinence. This final symptom is difficult to talk about, but incredibly important. Some women experience changes in bowel control, including sudden urgency or difficulty holding in gas. Though it's not often discussed, this is a recognized issue linked to hormone decline. The pelvic floor muscles, which support the bladder and bowels, are affected by estrogen and testosterone. When these hormone levels drop, muscle strength can decrease, especially if there's been previous strain, like from childbirth. This can lead to unintentional leakage during activities like coughing, sneezing, or exercising. While distressing, help is available. Strengthening the pelvic floor through exercises, dietary adjustments, and medical treatments, including hormone therapy, can greatly improve the situation. Most importantly, know that you're not alone and support is out there. From unusual sensations in your mouth and skin to vocal changes, sudden chills and challenges with bowel control, it's clear that menopause involves far more than we're often told. These symptoms are not weird or in your head. They're real physical effects of a hormonal shift that deserves understanding, not shame. If anything in this video resonated with you or answered questions you've been afraid to ask, consider sharing this with a friend. You might give someone else the clarity they desperately need. And now let's start the conversation. In the comments below, tell us, what's the most unexpected symptom you've experienced during menopause? Let's support each other and break the silence. As always, please remember this video is for informational purposes only and should not replace professional medical advice. Speak to a healthcare provider to get guidance tailored to your body's needs. Thanks for watching.